you for having me here. Well, I don't know if you have questions to ask, and I think it's always good when we do it in an informal way, but I really appreciate the topic today, especially in these times. And you used the word when you were talking about Michael and Jackie, learn. Didn't you have to learn about whatever in different communities? And for me, that's the biggest part of this advocacy and inclusion, and making other communities feel part of a greater whole. That's where I think for me, I better serve as a representative when I'm learning. I know I don't know everything about everybody, about every community, about every culture, but just being able to be open, just wanting to learn. And in reality, when I go to the Capitol, part of that was learning really with the other side. How were they thinking? What is their end game, or what is it that makes that person tick? And there's one of my opposing party members there at the Capitol. There's that individual who goes to the Capitol every day. He's an older gentleman, he's disabled, and every day during session, he'd go to the Capitol and he'd have all of these signs and these Confederate flags and just sit right outside the Capitol doors. We're walking in every day during session. And, I would say hi every morning to him, and he had all of this stuff on. But part of inclusion, right? Part of what we're supposed to do, or I believe our mission, is to see people for who they are, meet them where they're at, and learn about them. And I told one of my counterparts, it's wonderful that he comes every day. And he's like, what? I can't believe you agree with any of that. I said, I'm not saying I agree with his position, but he feels a purpose, right? He feels like he's part of something bigger. And I think at the end of the day, that's part of being a good advocate, is making sure that everybody who we work for, who we work with, feels like they're part of something bigger, that we're in this together. And so I'm not sure if you're going to have questions for the panel, but that's where I come from when I really talk about inclusivity and advocating for marginalized groups, is meeting people where they're at and knowing that there's a lot of things that I don't know, but opening myself up to studying more and listening to people so that I could find where there is a common connection. Zaylene, should I?
Just you say whatever it is. How do our elected representatives, like you at the state level, how can you help us when we are being challenged? When we don't know the doors to open, to knock on?
Well, I think people pretty much start with their own representatives, and sometimes your own representatives or elected officials won't meet with you. But I do believe that many times, or when people come to me, there's a lot of assumptions. People assume that I know certain things, or that I know what their position is, or where they stand, or they assume they know things about me. And for me, that has been the biggest help, right? Or the biggest pathway to really building that bridge, is to sitting down and educating, or being educated on whatever the issue is. I think that's most helpful for the community, for your community, for everybody. There is something, we all have something in common. So finding what that is, but it is true. There are individuals who won't even schedule a time to meet with you. But for me, and for many of my counterparts, I could say the biggest part is finding that connection. It's not really easy, but we all have this common. There is something there that binds us, and trying to meet that point and then building from there. But it is a challenge. It takes a lot. There was a letter in the beginning of my first session I got, and I received tons of these letters about that the state legislature, a certain party, wanted to ban the Bible. The certain legislation that were being introduced was about banning the Bible. And of course, that's not what we were trying to do. And completely disagreed with the individual. I got this letter, many of them, but this individual, I wrote her back and I said, listen, I assure you, we're not banning the Bible. There's a Bible in every desk, in every desk in the House and in the Senate, and I knew she probably didn't know that. I didn't know that. I never read that anywhere, but very few people know there is a Bible. So for them to say certain legislation was anti-Christian or trying to ban the Bible was really ludicrous, but she didn't know. And so she wrote me back and said, thank you so much. I'm a native Texan, I've been here 80 years, and I had no idea that there was a Bible in every desk, and she said, I also noticed you didn't agree with anything that I said, but I appreciate you educating me. And so I think part of that is the educational part, like finding somewhere we can connect. I knew she would appreciate that, even though I completely disagreed with her. I didn't really have to talk about that, but I did find some type of common ground. And I think that's really having those conversations and talking to people and seeing them. What do they, human nature, what is it that they're probably trying to get at, and how we can make a connection that way.
Ana Maria, when somebody has a situation where they're challenged, should they write a letter? Should they call you? Should they expect to speak with you? Should they expect one of your assistants to deal with them? How does it work?
I would say all of the above.
Let's say I have a problem. Okay, I was sitting at supper tonight, and one of my table mates was saying he needed to change his address with the with the IRS or the Social Security system, Social Security, and he couldn't get through on the telephone. So he finally went to the office, and he wasn't allowed in because he didn't have an appointment. But he couldn't make an appointment because he couldn't get through on the phone. Who do we call? What do we do? Apparently, after 4 months, the Postal Service will no longer forward your mail to you. What is somebody supposed to do? Is that something we can reasonably ask you to help us with?
So that's federal, but my team, we explore and we call around and ask the different agencies to see who can help us in that. We don't always have the answer, and sometimes they won't even pick up the phone when we call. It's not like we have a special, number to call. As a Texas rep, we do have connections with the state departments, but for example, federal Social Security, that's at the federal level. However, my team, we still try to figure out what's the number, what's the easiest pathway for constituents so that they can explore it from there at that point on, because we really don't on the federal level, but there may be something at the state level. And so we just kind of work and try to figure out how close we can get to solving that answer. Sometimes doesn't have to be resolved at the federal level. It's something that a state agency can help with or what have you. And so it just depends on the situation, but it's all of those, Aileen. It's calling, it's emailing, it's sending those letters, it's snapping back on, the social media sometimes. It's a little bit of everything. I think there's so much noise today, right? Everywhere we're getting, attacks and all these things are going on from everywhere, that we, as a constituent, exploring the different pathways and not just, I called once or whatever, but I think exercising all of those avenues and to try to reach out to your representative or your elected officials.
Okay. Go for it, Anna.
So I have had a situation where it was a federal issue. It was a passport issue, and I did call our federal congressman, and they helped me. So what areas would our state representative be helpful for?
That's a good question. Like, for example, the Texas Department of Public Safety, the Texas Department of Health and Human Services, any agency that's a state agency, where that, it could be foster care agency, it could be sometimes even our local, right, county commissioners or DART. We have issues with DART. Some of our constituents have issues with DART. So anything that has to do at the state level, your driver's license, your licensing and regulation, maybe your your business permits, things that happen here in the state of Texas for residents of the state of Texas, and it's only for us. That's really the areas that we could help in, but also your city level, because sometimes maybe you have a better relationship with your state rep than you do your city council person. Sometimes we have a good relationship with whoever that elected official is, and we can work, and try to help whatever happened at the local level. So it just depends, but for the most part, just think, okay, would a person in Illinois have this same problem that I have with this agency? Okay, if they would, then that's probably federal. But if it's like, no, it's just, something, a person in Illinois doesn't get a Texas driver's license. Okay, well, then that would be different. So it is kind of tricky, but just think about if it's something just exclusive to us Texans.
Yeah. I know that I had a problem getting title to my car. I was transferring it to my daughter, and we just were chasing our tails. And Anna Maria's office, within practically minutes, it was resolved. When my grandson first moved into Chai, which is a home for intellectually underdeveloped people. I'm losing the language. And we couldn't get the benefits that he was entitled to. And we kept getting rejected and rejected and rejected after 8 years being on the list. And they said, well, he's not even eligible. Why are you on this list? And this was your predecessor, Anna Maria. And there were 2 criteria, and they were only applying one. He absolutely qualified under the other one. And the door was open within 24 hours for him to be reconsidered. Then he had to meet the testing requirements, which he did, and we got the funding that we needed. But I couldn't get that door to open for him to even be considered after 8 years on the waiting list. So those are 2 of my own personal experiences with my state rep. And fortunately, both of them were successful. Now, what about with, let's say, drug companies or healthcare in Texas? What can you do in those cases where services denied, let's say?
And let me go back to Anna real quick. If you don't know, just call us and ask. For example, you don't know, is this a state agency or federal or whatever, you're still not sure, give us a call. And sometimes we can still explore certain avenues. So I wouldn't say don't call us at all, because there's sometimes that we can reach out to the congressperson and kind of work with them to get issues addressed. But the question about medical companies or what have you, that's a very good question, because as we know, lobbyists have a lot of power in the state of Texas, and many times they have lobbyists for different, organizations, different groups. They're forming all over the Capitol too. And so many times they'll stop by our offices and leave a card, or we have a connection or contact with those individuals. So if there is an issue with a certain company regarding your medication or whatever, sometimes we have a connection with an individual from that company who could help constituents, because that's really the whole point of us working together. So for example, when we had the freeze last year, there was a community member said, hey, after a day or two, my grandmother is in an assisted living home. She wasn't in my district, but he said, we can't, they don't have the heater, they're freezing, and this individual's like 80 years old in a home. And my friend's like, hey, this person lived in Plano, and they've been calling the different electric companies and nothing has happened. And so I made a couple of phone calls. Turns out, of course, it was Encore. And they said, well, we're sending people out. And I said, but no, they need this now. So they were able, within like 3 hours, after it had been like 42 hours or 48 hours that grandmother hadn't had electricity, that the Encore people were able to redirect some of the workers to go work on the transformer in that area and get their lights back on. So there are many times we can be creative, or there is, a contact that we do have or some relationship that we've developed that we can assist in those areas. So with pharmaceuticals, with medicine and all whatever that different constituents might need, give us a call. It's something worth exploring. Now, I will tell you this, I don't necessarily have the best relationship with a lot of the lobbyists by design, in terms of I try to keep at distance, but they're very clear in terms of if it has to do with constituents, they know that's where the majority of my conversations with them will be, is addressing the services and the resources they have to help constituents in our areas.
I know when the stimulus monies the checks were sent out, ours somehow is still in outer space, and I couldn't get a replacement check. And I called my federal representative and developed a wonderful rapport with one of his assistants. And that check, it didn't come immediately, but I couldn't get it and she could. So
that's wonderful.
You don't have to feel bad about calling these elected officials, because that's what they're there for. And they're very happy to serve their constituents, because when they do that successfully, they figure they've got that vote and they want that vote.
And beyond that, it's what I like is that when I get a lot of those phone calls, many times it's the same issue for several people. So after getting maybe, let's say 3 or 4 phone calls of one specific issue, then I know, hey, something has to change. If 3 or 4 people are having this issue, then it's likely 400 or 4,000 people. So we got to figure out how to make this process better. The only way we know is by hearing from the community, right? There's something maybe very nuanced that you're having trouble with that will never be on my radar unless we communicate. And then I know, oh man, this other person and this other person. And then, sometimes it is simple legislation, a couple of words that will help address that issue for future constituents. And so it helps us know what's really happening and gives us an insight on there's certain areas that we could tweak to make things better for all Texans. So it just depends, but always, it doesn't hurt. Just give us a call. And if we can't help, we can't help, and we'll let you know. But maybe it'll help us to do something better for all of Texans and draft better legislation to address those specific areas.
Let me ask you, please, people, I come from New York. I'm not shy. Don't let me dominate. I don't want to do that. I have called my senators, my state senator, my state reps and senators on committees, not in my district, but who will be voting on issues. How important is that? I know how important it is, but as a legislator, how important is it to hear from people in your district, but people throughout the state?
Well, can I ask everybody by show of hands, how many of you have called any of your state representatives or US representative senators? How many of you have called them for something? Oh, okay. So less than half of the group. Definitely do that. And even if it's something small or an email, building that relationship is very powerful. Zaylene, it's very important. So the way it works is, let's say there's a bill that's coming up and it's on your radar. There's a way that you can get on the Texas, it's called TLO. You can get on there and kind of put buzzwords that you want to be alerted when any legislation with these certain words come out or what have you, then you're alerted about that legislation so that you can go to a hearing or contact the representative to see if you want to improve that legislation or you think it's bad legislation. So once people, because people all over Texas do that, they have these alerts on their computers that say, okay, if it has to do with, whatever issue it is, foster parents, they get that alert and then they look at the legislation and they'll call us and they'll email us. So when we go to committee and we're hearing about that bill, the committee members do talk about, oh man, did you get those 100 emails about don't support it or about supporting it. And it does impact legislation. Like if nobody calls, there's no emails, the stuff goes through because it's non-controversial. Nobody really cares. That's kind of the way it appears, right? But if a lot of people are calling and saying, we don't really like that, or, there's certain things that we can tweak, it gives us enough time to do that. And so even though you're not in my district, because we can put that information in a system that says I got 40 calls and 10 of those were from my district, then I know what's important to my people. And then I know what's important overall to Texans. And it educates me on what other people are thinking. But it's very important because the numbers do matter. And we as elected officials, we do talk about it, about the influx of whatever it is, communication, supporting or opposing certain legislation. So even though you're not in that district, I say, we're still representatives for the state of Texas, even though we represent our communities, but we're trying to do something good for all of the state of Texas, not just for our constituents. So I encourage you all to play with the system a little bit, learn about, how to pull up legislation, get in the Texas, you could just probably Google Texas House legislation and play with that website just to practice how to find a bill and how to read the text and all of that stuff so that you'll be ready when session starts.
And when does session start, just in case nobody knows?
In January of next year. So January 2023.
I, for one, am very glad to hear what you just said, because I never thought it really had that much of effect. Mm-hmm. And I said, oh, well, I'm not going to do it because it doesn't matter. But you're saying it does matter. And that's,
yes, ma'am.
That has made a big difference and impact on me.
Oh, well, good. I'm glad to hear that, Sandy. No, it does. And it's funny, we do have those conversations right before we're going to vote on a bill, or and it sometimes even will get the bill not even heard. Sometimes the chair will be like, you know what, that's too controversial. We're not even going to hear that bill. We're going to leave it until whatever, and then we never get back to it if it's that bad. So it just depends, but it's always good. It's always good, because what I do when I'm voting on a bill, there's always a list of like witnesses that testify on a bill. I always look at the pros and cons of a bill. Let me tell you, when we're voting on bills, we get a note, like a packet of papers on our desk that kind of gives us an outline of the bills and tells us, or suggests, both parties do get a packet that suggests how they should vote on a bill, whether they should support or oppose the bill. Both parties get their packet, and a lot of people just look at the packet and follow what the packet says. But we also get another packet that's nonpartisan. And in that other packet, it's more, it tells us who came to be a witness, who testified for a bill, against a bill. And then in my system, I see who people have called me specifically, and other constituents. And so I sit there and I read all of that to see what is the nonpartisan, what is the balanced perspective, who was against it, who was for it. If I see the teachers union, or if I see, the Sierra Club or whatever that came to testify for or against, I look at all of that. And it's really helpful to me. I look at all of the witnesses, what organizations they come from, how many calls did I get, how many letters did I get? And then I also go and tell other reps, hey, 5 people from Houston came and testified against it. Are you sure you want to vote for that bill or whatever? So, it's rich in information, but we only get those perspectives or the idea of where our community stands is if you guys call and write those letters, send those emails and stuff. And we do have those conversations.
That's really, I'm glad to hear that. I just poo-pooed that process all my life. Thank you.
Oh yeah, no, yes. And I'm notorious for, reading everything and seeing what people are saying and going to other reps who, because of people who've contacted me that don't live in my community, but I'll tell the other reps, hey, do you know people in your community? This is how they feel about it. And so it allows us to have those conversations. And sometimes they do pause and they're like, okay, well, I'm going to have to put a hold on that. We're going to have to explore that a little further. So it's very helpful. That's the only way we're going to be better at serving people.
Thank you.
Yes, ma'am.
Anna Maria, thank you very much for all
Thank
that you
you.
have shared. And I'm glad people spoke up. Yes, yes.
Yes, ma'am. Thank you.
Now it is Dr. Michael Van Gro's turn. And Michael, we are very eager to hear what we should be aware of, what our power is in crisis situations. So thank you for educating us.
Okay.
Here
Can
he
you hear me
is.
now? Thank you for having me here. I'm not sure why. I do advocacy for Texas at the state level and the federal level through the Texas Medical Association, but that's of no value to you as an individual. But over the years, I'd have patients that would come in and tell me that they had no idea what their doctor was telling them. Or if somebody was in the intensive care unit and it was explained to them things that they had to make a decision about, they didn't understand that either. Although the doctor would always say, do you have any questions? And you know what happens? No, I don't have any questions. And then 10 minutes after you leave, you don't have any knowledge at all. Because you don't want to be embarrassed. You don't want to be talked down to. But the fact of the matter is, I spent a lifetime learning a foreign language. At times, words I have to look up because I can't spell them. But it's my job to inform you. I'm very saddened what's happened in the last 2 years. We don't do that anymore. We tell you, and that's wrong. You get to decide what happens to you and your loved ones. We don't. And I think too many colleagues have forgotten that. So what we started was something simple. It started off with relatives, and then friends of relatives, and then it's getting bigger and bigger, and we may have to put a website together, I don't know. But basically, consider this picture. Say you're driving in a car in Colorado, one of my favorite places, and you're in a car accident. And your loved one is seriously injured and life flighted to a local hospital. You've never been there before. You've never been to that hospital. You don't know any of those doctors there, and you sure as hell don't know what's wrong with your loved one, except that he or she is unconscious. The doctors will explain to you after a while, right? You can't come in, you got to sit out in the waiting room and tell you what's going on. And then sometimes they'll tell you, you got to make a decision. They'll say, we can't bring him back. It's a lost cause. Is he an organ donor? Now, think about that. I don't care if you have a DNR, do not resuscitate, or if you have you're not ready for that. You're never ready for that. And you don't even know what to ask because you're in shock. And plus, all doctors are the same, aren't they? With all due respect to Ms. Ramos, all representatives are the same. And she looks to be an exception, but you understand my point. So they started asking us, this is what the doctor told us. Here's the records, because they have a right to see them. Did you know that? Well, oftentimes they'll tell you, you can't see those records. Well, bullshit. I can. They have to show them to any doctor you want them to be seen by. And many of us, like me, are licensed. I'm licensed in 38 states because I do telemedicine now, but quite a few doctors around can do the same thing, okay? And then it becomes a litany of asking questions. And here's what I've learned. You all aren't as dumb as you look. You're pretty damn smart. And he asked some pretty good questions. And sometimes I think you're smarter than the residents. I've had the disfavor of training because you can't yell at them anymore. They get their feelings hurt and they run to the chairman. But be that as it may, okay, your common sense prevailed. And if it doesn't feel right, 9 times out of 10, it isn't right. We've had patients that would have died based on stupid things that stupid people did, and you never would have known it because you didn't understand what they were telling you. So to have what they say put in English without talking down to you, which is their job, but they don't do it. And then what questions you can ask. And I'll tell you, I learned another interesting thing. When you start asking questions, you weed the wheat from the chaff right away. The arrogant ones don't want any questions. Those are the ones you need to fire. And you know what? You can fire them. Do you know why you can fire them? Because you're paying all the bills.
Mhm.
And believe me, when the bill comes due for $250,000, they'll take your house. They can't, but that's what they'll try to do. Okay? So that's the advocacy that in the last probably 10 or 12 years, ever since I got home, that I've really wanted to do. And I'm amazed at what people will say and go, wait a minute, how did you know that your husband didn't have a stroke? When the doctor is telling her that her husband had a stroke, she's right and he's wrong. But how do you ask those questions and find those people that really give a damn about your loved one to take care of them? Because if you notice now, nurses are busy with acuity. They got to, I can't even read it anymore because the handwriting's so small. They have to fill in all this paperwork. Years ago, doctors ran hospitals. Did you know that? We ran them all. And we kind of got lazy, and it was a headache, and liability was happening. So we're the ones that set up this specialty called hospital administration. That was us. And now they run us. They run the hospitals. They run the hospitalists. They have certain doctors they were allowed to work by certain contracts and others that can't. But you have a lot more power than you think. For example, after it's all over and you get the bill and you go, oh my God, insurance isn't covering this, and you want to just go over the bill with the hospital, you know what they'll tell you? By and large, well, we'll go over the bill with you, but it's only going to end up being more for you, and we don't, you shouldn't be doing this. You should just pay it. Set up a payment schedule. Do you know that 9 times out of 10, your bill is going to be wrong in your favor? Don't let them threaten you. Don't let them intimidate you. We have enough issues in medicine, more so in the last 2 years than we've ever had before. And a lot of us are kind of tired of it. A lot of people in my peer groups have quit. They just don't want to do it anymore. It's just too much of a mess. And too many others just listen to what they're told. But remember, we went to medical school to be critical, independent thinkers. Remember that? And we were supposed to use that for your benefit, not mine. We were taught that if you do a good job and you have a good outcome, which would be nice, you'll have a good living, not the other way around. So that change is the advocacy, and I picked up some other people with me in that we do it, and it's growing. It's getting bigger. But like everything else, it's not something the hospitals want to hear, right? Because they want to just be able to tell you that, listen, and basically when the DRG is up, you know what a DRG is?
Mhm.
It stands for Diagnostic Research Group. It's Medicare. And they came up with all these rules. It says if you have, say, a pneumonia and you're in an intensive care unit, we'll pay for this many days, we'll pay this much. Now, if the hospital can get you out of that ICU earlier, they make money. If you're in that ICU longer, they lose money. You starting to see the picture? And when they moan about not taking care of the people that have no money, the only people that lose money in that deal are the doctors. We don't get paid. The hospital gets paid by federal funding, Texas funding, Medicaid, and everything else. So with all due respect, the medical profession is not your friend. They're supposed to be. And I know that you love your personal physician. I know you love your personal physician, but you don't like the profession as a whole. And there's a reason for that. Any questions?
Mike, I've had problems every year. I have just hit my 5-year mark with brain cancer, and I'm finally clear. But I've had every year to go to battle with my insurance company to get my brain scan, because they've had to send to a pre-screening company who decides whether or not it's medically necessary for me to have my brain scan. And
Okay.
the people that do the scan are usually a pediatrician and a gynecologist.
Okay, let me, this is something that Ms. Ramos can help you with too. The insurer gets a third party that reviews all these.
Right.
I actually was at I was one of those third parties for Aetna. I was one of their medical directors downtown in Dallas. And most of the time, the people that say no aren't even in that specialty. Did you know that?
Exactly. They were so far off.
They're just somebody that they hire to do that. Okay. So there's various ways to do this. Your doctor can call, you can appeal, and they have to see you because you're getting insured. They can't run you away. They'll try to stall it. But people that actually go to the appeal and you'll go, I would say about 85 to 90% of the time you win. So you have that you can do.
Every single time, but the doctor had to go to peer-to-peer. We lost it at peer-to-peer. I had to go to advocacy, and I would lose it at advocacy. And every time I would call and say, okay, here's how it's going to go. Now, and I'd ask him for their name, and I'd say, okay, now how do you spell that? And I'd say, okay, so since I have a brain tumor, I said, my family's going to put down that if I die because you didn't pay for the $235 brain scan, that they're going to name you in the death situation, just double checking how you're spelling your name. And the doctor, and we'd redo that. They'd have the authorization by the time I hung up the phone. But I
I'm not against bullying them, but I will tell you that every time you shouldn't have to keep going back for the same reason.
I know it was kind of silly, but
did you ever ask them, what are the criteria that you use? It's written, they have a regulation. What is the criteria that allows this to happen? You know, when you get your insurance, you're probably on Medicare or whatever else.
No, I'm not. I'm only 60.
Okay, so you're on Blue Cross or Aetna or Cigna or United.
And better.
Yeah, even worse.
Yeah, I know. Sorry. I'm self-employed.
All you know about your plan is your copay, maximum out of pocket, and what you have to pay up front before they pay 80 or 90%.
Exactly.
When you buy a car, don't you get a manual of how the car works?
Yep.
You don't get a manual in your healthcare plan, and they won't give you one. But you have the right to ask. You have the right to ask to have given to you the criteria that they use to say yes or no about your scan. Because that's all they're doing. They're looking at a piece of paper that they've been given. I'll give you one better. We had a problem, the company, Aetna had a problem nationally with fentanyl lollipops. Everybody knows about fentanyl, right?
Mm-hmm. Okay,
fentanyl is cheap, as too many people have found out. But you know what? When you put it in a lollipop, it's $200 a pop. So when they put it together in a pop, and they realized that all the pain guys were giving out these fentanyl lollipops, and they saw this spike. So they came up with a regulation to ban it, to stop it. But they wouldn't tell the people what they had to do to get it. But you have a right to know. That's where your local representative, your federal congressman can help you, because there's no reason as a consumer that you pay for that plan that you can't know what is the criteria for me to have a brain scan with brain cancer.
All right.
You should have a copy of that regulation anyway. It's only a couple of pages. And then when your doctor orders it, he'll or she will know how to write that request so that it gets authorized. And that'll save you a lot of pain.
Good to know. Thank you.
I'll send you a bill. Don't worry.
I
Why
want
does
to say
everything
something.
have to be a fight, though? That's just what, I can't fight. I don't like confrontation, and everything needs to be a fight.
Okay.
That's
Then
where
bring
I
a friend.
lose.
Bring
And
a
that's
friend.
where I just pay, I guess, and I lose.
No. You should bring somebody always with you no matter what. Oh, that's another good point. If you, God forbid, are ever in the hospital or someone you love, never leave them alone anymore. You have a family member with them 24/7. You understand? And
Really?
sometimes it might be a kid, you know, a teenager, or 18 to 20, whatever. And something is happening, and they'll call you. You can talk to them on the phone and come in and stop things from happening. You know, bad things happen in the middle of the night. And I know this because I was a patient in 2017 at a hospital. I'm a senior attending, and the hospitals almost killed me. Can you imagine that?
No,
If
no.
they would do such poor care for me, what do you think they're going to do for you? I'll tell you what, though, she was pretty damn arrogant. When she was ordering tests, and I asked her, why are you ordering that test? She didn't know, because she Googled it. They always have their cell phones in their hands. When I told her that the reason why my liver functions were elevated was because of the Lovenox they gave me. She said, no, it's not on Google. I said, I did those clinical trials in Dallas. We know this to be true. That was how we knew it. People were on Lovenox. She didn't listen. She ordered a liver scan because Google told her I was in liver failure. And then I said, how can I be in liver failure? Do you see any yellow in my eyes? Are we talking to each other? Do I look comatose? Because after a while, you start to get, well, particularly like the New Yorker up in the upper left-hand corner there, you start to get a little sarcastic and a little pushback. And they'll just walk out of the room. Now, we couldn't do that in my day. You'd get fired. But they do that now. But don't let people push you around. I'm sorry if it's a fight.
It's a good thing to.
But it's your money. I don't think you like spending your money down the toilet, do you? If you do, I'll give you a P.O. box where you can send it.
I had a circumstance last year where I ended up in the hospital for a week for gallbladder. And I started off in the emergency room and went from room to room and ended up in the ICU. Well, I had the gallbladder taken out on a Friday afternoon. And the doctor from the ICU came to me at 10 o'clock Friday night and said, we're going to move you to another room. And I looked at him square in the eye and I said, like hell you will. I'm not leaving this bed. You don't need this bed. I saw empty beds all over this ICU as they were wheeling me out, and you're not moving me. So he pulls this chair over to my bed and I thought, oh God, now I'm in really trouble. And he said, well, I said, my husband's a doctor in this hospital and you're treating me like a piece of meat. And I mean, I just went berserk. So he came over to me, pulled his chair, and he said, well, we won't move you tonight, but if we need your bed, will you move? I said, of course I'll move. If you need my bed, I will move. So my question to you, Mike, is did I cost the insurance company money by advocating for myself?
No, you cost the hospital money.
Hospital money.
And I
Well,
hope you guys will appreciate a Boston boy. I don't give a shit. They got plenty of money. It's not a big deal. By the way, my wife would call that doctor an educated moron.
Why? Explain.
Well, we got a lot of people now. Remember, we wanted all our kids to go to college, get degrees, get letters behind their names. Now they're smart. They're so smart, they think they know more than everybody else, even people that just work for a living. They don't. In fact, a lot of them are pretty stupid, even in the areas that they have their degree. The fact that, okay, like I said in the beginning, all doctors are not interchangeable people, just like all people aren't. But you don't know that. How do you choose your doctor? If you're stupid, you're going to use the internet. Usually you'll ask your general practitioner or your general internist, hey, who should I see? And you'll go wherever they send you. I've sent patients to doctors I can't stand, but they're very good at what they do, but they may not have good bedside manner. But I'll prepare my patient for it. And so that's not why I'm sending you. And I choose to send patients for a second opinion, which, by the way, we should all do, especially with a chronic disorder, to doctors that train in different parts of the country. I train in Boston, others train in LA. They have a different perspective on how they look at things. And that's important, I think, when you're looking at a person and trying to figure out what's wrong and do the right thing by them. But you said earlier that you're not a fighter. I suspect you are.
Not usually, but okay. In that instance, I was.
Mike, this is Linda and Sandy, Linda Markowitz. If I can add something real quick, Sandy. I've worked in hospital units and run hospital units. They usually do a census at midnight, what patients are in what beds as of midnight.
What?
So yes, it's the census at midnight. So by the physician wanting to move you at 10 p.m., it was probably because when they did the census at midnight, you would be in a lower cost bed to the hospital than an ICU bed.
Yeah, that's true. That's true, Linda. And also because at 10 o'clock at night, if they can get her out of the ICU, nobody has to make rounds on her in the morning. And we generally make rounds in the ICU very early before we make rounds on the wards. So all the reasons aren't important. None of them had to do with you.
Really?
Really.
Huh.
No. Or they were short nursing staff, or a nurse called out and because the census in the ICU was above a certain number, they needed another nurse. Yeah, it's generally not, I hate to say, not because of your medical condition.
God, that really upsets me more of what you just said, because I went berserk.
True.
I called my daughter, I called my husband, who is a doctor who just,
I know. Yeah.
and my daughter thought they were going to take me to a loony bin because I was reacting so crazy. But the next day she said, you know, Mom, you don't need an advocate. You are your own advocate. And
Yeah.
you
I'll
know
make a
what? I feel
suggestion.
very
I'll
proud
make a
of that.
suggestion for you. I told you before, someone should have been there with you. That's one. Okay.
Yeah.
But you should do what my 2-year-old grandson does. When the doctor said at 10 o'clock at night, we have to move you out of the ICU, why? Let him answer it. And then say, why?
Yeah, I probably should have found out why.
About the third or fourth why, it's going to come out what they're really doing. Or you can't answer. And if you can't answer you, then I'm staying. Because certainly, if they needed the bed, you'd give it up. If somebody was sicker than you, of course you would.
Yeah.
Anybody would do that. There's nothing wrong with that. And if they told you, we don't have enough nurses anymore to take care of you tonight, but we do up in the ward. That's a trick question, because the acuity on the ward is one nurse for 5 or 6 beds. In the ICU, it's one nurse per bed or 2 beds.
Yeah.
So don't get conned by that. But if you have somebody with you, that person can help you as an advocate. It's always better to have a couple of people present rather than one. They don't like witnesses. Lawyers do.
Yeah, can I say something? So we've had experience in hospital recently, and I agree. You definitely need to have someone with you. It's really important. But I also
Okay, I'm on my way to Brooklyn. I'll see you later. I'll be with my husband. Are they going to let me stay with him all night? Come on, they're not going to let me stay.
Right.
Not
Well,
with COVID and all this stuff going on.
Sandy, then you ask them why not.
yeah, I've stayed in the hospital during COVID. You just have to be masked.
With somebody, with whoever was in, yeah?
Yeah, I have.
Yeah,
But- Yeah, I have. And I guess, sometimes, I guess too, I want to say that if the patient is fully alert, you were coming out of anesthesia, I'm sure, your mind was thinking of, it wasn't completely clear. But I do want to say too, I understand what you're saying, Mike, about advocacy. And it's a line to toe to be diplomatic too. Because you don't know if there's someone else that you can talk to. You might be dependent on that person or that nurse. And so it's a balance of being pleasant about it, but being assertive too.
Being civil is always true. I never meant to say you should lose your top and whatever. Sometimes you have to, but that's not my point. And you have other rights too. You can say, I want to talk to the nurse, whoever's in charge of nurses tonight. There's somebody in the hospital, or I want to talk to whoever is in charge of hospital administration. There's somebody in the hospital at night, so that you can voice your concerns. But they expect that you're going to be afraid to do that. They just don't think that you have the guts to do that, because they're the hospital. They know what's right for you. What do you know? It's like school boards. They know too. We've given up all of our individual freedoms and rights when we never should have done that. We should have learned how to use them. And as you said, be diplomatic. There's nothing wrong with that. There's nothing wrong with understanding the system so that you could be, she was going to help that doctor if they needed the bed. That's pretty damn good. She might have been real comfortable there watching a TV program, but she would have given it up for somebody else who was worse. So we need to be a part of the equation, and we're not. We're just something to be pushed around in terms of money. And we did that. That's on me. When we gave up hospitals to hospital administration, you know what kind of a degree that is? Business. It's not medicine, it's business. And the chief medical officer of the hospital works for the hospital. Doesn't work for you. The only person that works for you is supposed to be your doctor. But if you have a hospitalist working on your case, they don't work for you, they work for the hospital.
Yeah,
The days of us having our own patients in the hospital and we took care of you, they're gone. Most of us now just send you to the hospital, and the hospital has their own doctors to take care of you. So you're going to have to be a little bit more, I don't know what the right word is. Sandy, you probably know what it is. Somewhere between Anna and Sandy, somewhere between that.
Somewhere between us.
Yeah.
I wanted to make another comment too.
Okay, Anna, we're gonna let you be the last one.
Okay, I wanted to make another comment too about your rights. Sometimes insurance doesn't cover some services that you need or want. And I want to tell you that everything is negotiable. You can negotiate things ahead of time. Better to do it ahead of time than afterwards. But everything is negotiable in terms of price. If there's a procedure you have to have and your insurance isn't going to cover it, you can talk to people and say, look, my insurance isn't covering this. What's the best price you can give me?
One last thing about that point in particular. Your doctor, if the doctor that you see is in your plan, there's nothing we can do about it. It's whatever the negotiated rate is, that's what we get. And no more, okay? If you see a doctor out of network, they can charge you whatever they want, and you're at risk. You could go back to your insurer and say, look, can you pay some of this? But they can deny the whole thing. The key to insurance is to negotiate before you have something done, okay? So if you know you're gonna have a procedure, ask them, how much of this is covered and what is it? People don't do that. You just go in and have the procedure, you get the bills and go, well, I'll submit it to insurance. And then when they say no, that's when you have the conversation. And honestly, they don't care at that point. You can still
Like
win.
in the three situations that I'm thinking it happened to our family, they were emergencies. My gallbladder was an emergency. My husband fell and that was an emergency twice. I mean, those are emergencies. You can't
Okay,
negotiate
there's good
that.
news and bad news. For emergencies, your insurance has to pay, period. However, that's the hospital bill. For the doctors that aren't on your plan that see you, that's the part that's negotiable. That's why we push so hard for no more surprise billing, which a lot of doctors fought. I wonder why.
I'm gonna stop. This is so fascinating and so relevant to so many of us. And Michael, I don't know if you're on call for us when we are pulling our hair out, but I think that this discussion has been very helpful. And I thank you so much for it. And
You can always reach out. If I can help, I'll help you.
Thank you.
Thank you.
It's
Thank
not
you.
a fee for service. And remember, I'm not your doctor. I don't play one on TV. I'm just here to help you understand the wording of what they're asking you and maybe some questions that may help you. You're going to have to make your own decisions what's important to you. Don't ask me to say, what would you do? I'm not going to tell you. I know what I would do for me, but that's too much power. You have to decide. Just remember that. It's your life.
Thank you, thank you, thank you. And now we come to our international resources. Yeah, well, you are. So Jackie and Michael, we're very interested to hear what advice you can give us, what you can teach us.
Well, first of all, when we were in the Peace Corps, it was a 2-year commitment, and we're dropped into. We served in Panama, so we're dropped into our location in Panama with very little useful information, and it's a totally different environment. So we had to learn the kind of a new culture where we are, and it took about a year of that 2 years to figure out the culture, what was going on, and then we had only a year left to try to make a difference, and that's not long enough to really make a change. And that's one of the problems with having a 2-year commitment. It's not long enough, but somewhere along the line in that first year, we came to realize that as a culture, there was a feeling that Panamanians had. It was what we called what I called learned helplessness, and this was based on, I think, historical precedents where it used to be a feudal society. There was someone from Spain had come over, and they owned all the land, and they had serfs that worked the land, and they never got to make any decisions. They would always have a boss making decisions for them. So the people are very docile. They're not assertive at all. And what happened was, one day there was we were primarily teaching English. One day there was an English professor that was sent in by the embassy, and he was telling us the story that he had a group of master's degree students that he was teaching, and he gave them an exam, and he told one of the students to go to his briefcase and bring his exam to him so he could talk to him about it. And he didn't do it. And he couldn't understand why isn't he doing what I asked him to do? And he finally realized that, students are not allowed to go into briefcases, and, they've learned not to do that kind of thing. And the same professor said that he was telling them, to do certain things in their class, and they were not allowed to do what he was telling them to do, but they wouldn't tell him, we can't do that. It's because there's like it's acquired helplessness. They feel like they're not empowered to make any changes. And so we should be very lucky that we live in a country where at least, being assertive is accepted, and we should take advantage of that, like we've been talking. And so I just finished using the COVID downtime to write a book about the experience, and I have a whole chapter about learned helplessness in there, and how it affects their society. But we go to the store in Panama. When you went to the store, if we needed a light bulb, we'd go to the store and we'd find a store that had a light bulb that we needed, and we go to the cash register, and they had a place where they would, a light bulb receptacle. They screw it in, they turn it on, make sure it worked, and then they charge you for the light bulb. If you got home and 3 days later the light bulb stopped working, you were out of luck, because it worked at the time that you left the store. And this whole concept of consumerism that we have, where we have the right to make decisions and to question the doctors and all that. It's uniquely American. And it's a good thing that we have that, but we don't realize how lucky we are that we have that. Because in cultures around the world, that doesn't exist. And even though there are problems with our system, it's so much better than what people around the world are facing, where they don't have anything close to that. The old idea of caveat emptor, where the buyer beware, applies around the world, whereas in the United States, we do have a lot of buyer rights, and we should be grateful for that, I think. It's difficult when you're dropped into an environment that you don't know anything about, and you take with you the way of you do business, and you don't realize that they don't do business the same way, and it takes you a year to figure that out. It goes beyond learning, like the representative said. You've got to learn what the situation is. You've got to learn a whole new way of thinking that is totally foreign to you.
It's a different culture.
Completely. But that's part of the joy of the experience of living in a foreign country, that you have a completely opposite way of looking at things in a lot of respects. I see Anna's shaking her head because I know that she's experienced a foreign culture as well.
Spend time in Honduras.
It may be the same there, but for all the complaining that we do as Americans, and I'm not beyond complaining about things here as well, we do have it a lot better than most of the world. So we should be thankful for that. Oh, well, Jackie was telling me to talk about, at one point we were planning on, we wanted to see an island that used to be a penal colony, kind of like Rikers Island or something like that. It was out in the bay. And the only way to get there was to take a boat. They didn't have any hotels or any place to stay over there. There was the equivalent of the Environmental Protection Agency in the United States in Panama. They had their organization, was called a NAM. That's their Environmental Protection Agency. So they would run ships out, or not ships, rowboats, basically, out to this island on a regular basis to care for it. And they had cabins there that you could stay in if you worked through that. And we worked, it took us a while to figure out how you get to the island, and you had to do it through a NAM, which was a government agency. And we worked with a NAM to make arrangements to go out to visit the island, because it's supposed to be a very beautiful environment. And we never got, this island's called Coiba. We never got to Coiba in the entire 2 years we were there, because it was always something that there was always some obstacle. The system doesn't work. You make plans and there's always something that comes up that prevented us over and over again from getting out to that island. And it just wouldn't work that way in the United States.
Well, even going to Decameron, there's a resort on, Panama has lots of beaches. So we were at a resort, and you get there and they said, oh, well, your room key isn't ready. Come back in a couple hours. And then they say, well, make a reservation for in a restaurant for dinner tonight if you want. So you go there and they say, well, we can't give you a reservation if you don't have a room number and a room key. Well, they hadn't given it to us. And then you get back to the desk. Okay, it's time. Do you have our room assignment? Yeah, okay, here it is. And they give you one key. I said, well, we're 2 people. Can we have 2 keys? Oh, well, no, there's only one key, and you have to pay $15 down on another key. And then if you turn it in, we'll give you your money back.
but we can't do that today because the guy who makes the extra room key isn't here today. And, you know, just culturally, it was hard. And you think, this is what you're advertising. This is what your policy is. You're not, this doesn't connect, you know? And
You know,
so
I'm thinking as you're talking that you're talking about experiencing all these things in a different culture. And I know you speak Spanish, but it's not your mother tongue. And I'm thinking, I'm looking at the people here who I think are pretty sophisticated, maybe because they've had to be, because they've dealt with medical stuff, because that's what we seem to have just talked about. But for so many people, when they're parachuted into a medical situation or a legal situation, or something that's completely, it's as foreign to them as you being in Panama. And so I think, you know, this idea of advocacy, Zaylene, you know, is so important because I think we all at different times find ourselves in places that are like being in Panama for 2 years.
That's a great analogy.
That was wonderful analogy.
And actually, I felt that way moving to New Mexico in a way, because the culture here is so different from Texas, and especially in terms of medicine. So this is a population of the state. The population of the state is 1/4 of the population of Dallas. So, I mean, we're talking about, you know, apples and oranges in terms of the number of people. So the number of doctors is a lot less, and it's harder to find doctors. And, you know, you're sent to do a consult with a doctor. You're not told why or what the need for it is or anything. So the situation is very similar to being dumped into a Panama where you don't know what's going on, because it's like learning a whole new system of medicine being plopped out in New Mexico than it is in Texas. And in Texas, at least, you've got a whole slew of really excellent hospitals in Dallas, and you've got doctors that are, by and large, you can always find a good doctor for what you need
and be seen in a reasonable amount of time.
be seen within you know, a few days. That's not the case here.
No, I mean, it took about a year, but finally I have the doctors lined up that I'm comfortable with. But and you get here, we got here like in November before Thanksgiving in 2020. And you know, you think, okay, well, this is a new year, it's January, I have to line up some doctors in case we get sick. Oh, okay, well, we'll see you in May or April, or, you know. Wow. But it's fine if you can ease in and you're well enough to do that. And now I think we're good. But I found doctors that we're comfortable with, we trust. I have dentist, I have my ophthalmologist, I you know, I have everything now, but boy, it took a long time. And I'm like, what do you mean you'll see me in April? This is January. And, you know, you try and be an advocate for yourself and say, well, that's the only thing we can accommodate. But what if there's an emergency? You go to an emergency room. You know, it's just different.
Can I ask you a question?
Please.
Everywhere that I've been to a couple places. What is it about Americans that think that wherever they are in a foreign country, that country should treat them the same way this country does? Why do we do that?
Good question. That's a bad expectation. I don't know why people feel that way, but that's what I'm saying is you shouldn't feel that way, because we operate under different systems, even from one state to another. So when you go to a foreign country, you can't expect it to be the same. You're going to have to learn their system. It's going to take you a year or maybe more. And, you're not going to be able to change that system. You're going to have to live with the system.
Regardless of how people feel about this country, our Constitution is the only one in the world which values the individual, not the collective. Everywhere else you go, it's the collective, not the individual. And when we go as a military organization for humanitarian assistance, I could tell you stories how hard it is to affect that. Because things that we would normally take for granted to do, you can't do that. That's a woman, you can't touch her. On and on and on. And we're so ignorant of other people's rules, regulations, mores, whatever, because we think that ours is the best. I think it is, but that doesn't give us the right to push it on others. And I think when we do that, they're going to push back.
I couldn't agree with you more.
I agree with that.
So one thing that I found, because Zaylene said, how do we advocate relieve stress when you're in a stressful situation? What I found useful is to always have a worst case scenario plan. Most of the time, you're not going to have the worst case occur to you. But if you think it through in your head, what would I do in the event that this horrible, result occurred? And you have a plan in your head. You've thought about it. You have a plan B, a plan C, a plan D, maybe, and then you have a worst case plan. You're never probably going to reach. I have to deal with the worst case plan, but just having thought about it in advance will help relieve the stress in dealing with that situation. So, I'm not thinking I need to go to the hospital anytime soon, but I have a healthcare directive that says what's going to happen. Who's going to be able to talk for me if I go to the hospital, and I have a living will for end of life decisions and that sort of thing. And I've thought about these things in a worst case scenario. Hopefully I'll never need those documents. I'll never need to rely on them. But the fact, if you haven't thought about these things and you get into a situation, where you can't talk for yourself, it's very stressful, I'm sure. If, you're doing last minute scurrying around to try to make decisions. So it's something
you may have thought about this, but are you aware that there are organizations that you can buy membership in that will fly you out of the country to get better health care if you don't have it? Most people don't think about that. And it's like insurance, right? For your trip. In other words, if the trip doesn't go, I get my money back. If you're a veteran, there are a ton of veteran organizations that do that. But there are a lot of organizations, I think Emergency Assistance Plus comes to mind, where they will actually fly you out of the country and your wife it may not be to the United States, but it may be to a legitimate hospital if you can't get what you need to get where you are. Just something to think about in terms of your planning. I agree wholeheartedly, but I'll leave you with this thought. In the military, we're trained before we get involved in an adventure, we should know how to get out. Look at all the wars we've been in for the last 20 years and how did that work?
Right. So before I went to Panama, the Peace Corps is, you put your life in their hands, in the United States government's hands, to, prepare you for emergencies if you have to be evacuated. But I met with a man in Dallas whose business was to get executives out of the country in the event of a catastrophe. And I'm glad I did it. I carried his card with me the entire time I was in Panama, and I never needed it. But that was something that, the type of advanced planning that I'm talking about, a worst case scenario, just in case I had thought through, what I needed to do. I had somebody to call.
One of the things that we've offered, not just our congregants, but non-members, non-Jews, is participation in the Conversation Project. And I'm not sure that you are are aware of what that is, it prepares people to have conversations with their loved ones about their end of life wishes, not how they want to die, but how they want to live at the end of their lives when they are not capable of communicating. And that's something that I'd be glad to talk with you about at another time.
Was
And
that
put you in
Ira,
touch.
was that Ira Corman's topic?
No,
Oh, he didn't do that one. I can't remember which one.
no, Lori Miller did.
Oh, Lori, right.
Yeah.
That's very important. I agree with you.
Yeah.
Yeah, and if you go online to the Conversation Project, all their materials are free. You can avail yourself of anything. They have videos, they have manuals. They will do a really good job of providing you the support that you need. And in many of the states, you can join groups that will sit with you for an evening or an afternoon to talk you through this. I'm looking at the clock, and I think this was such an important evening, and I think that the two of you have really given us a different perspective on how we function in our culture, in our society, in the world. And I think that, Michael, you have opened up our eyes in so many ways that are so important. And I think Anna Maria has alerted us to the power that we have over government. And I thank all of you for what you shared with us tonight. And I think we're better for having heard what you've had to share. Thank you.
Thank you, Zaylene, for organizing this.
And this has been recorded.
Yes,
If you
I
want
did
to,
record it, yeah.
if you want to watch it again, if you want to recommend it to some of your friends who haven't had the opportunity to be with us tonight. And as always, what we offer has no cost to any of the participants. So,
Zaylene, is there a link? How does one refer a friend to this program?
well, Linda has recorded it, and
I
I'm
will,
sure-
I will send this to, I'll send the link to Zaylene, and then you can send it out to whoever you want.
right, but additionally, this has been posted on our website. So if you send it to Kenyette, she should be able to put it in the appropriate place.
Yeah.
Thank you,
Hi,
Linda, for
Karen.
hosting
Good night,
this.
Thank you.
everybody. Hi,
Good
Karen,
Karen.
I'm glad
Thank
to
you.
see you.
And
And
You
I
guys,
love the
everybody be
fact
healthy.
seeing
Bye.
you.
Fern, I
Yes,
think